Good morning. Getting my marching orders. I'm pleased to be here this morning joining in with Philadelphia Fight and my colleague, Councilwoman Maria Quiones Sanchez, to announce this opening of the first Spanish-speaking clinic in Philadelphia. And now I would like to introduce Jane Shaw, who is the Executive Director of Philadelphia Fight. She's working very hard and has been. And I think this is a great program. I'm glad that they were successful in obtaining the funding because it targets a specific community, not that other people will not be allowed to be served, but it gives a targeted area to a community where we really need to focus on to educate and encourage people about the issue of HIV/AIDS. And their agenda for the few years that they've been in office and running the program, it's really focused in on health issues around HIV/AIDS, and I appreciate it very much. I must say this council, from the very beginning, back in the early 80s, late 80s, early 90s, when I became a member of City Council, had no hesitation about focusing in on providing health services to our citizens, in particular around issues like HIV/AIDS and health clinics and those issues that are important so that our citizens will remain healthy. So Jane, come forward, take your bow, and thank you so much for what you do. And we also thank, where's Mike? Okay, thank you so much for your hard work and what you do and the staff and everybody. Thank you. Jane.
I want to thank Councilwoman Sanchez for helping us to organize this event so that we're in a position to really announce this to the community. So what we're here today to announce is a joint project between Philadelphia Fight, which is an AIDS service organization in Philadelphia that provides HIV primary care to people living with HIV or AIDS without regard for ability to pay, and Prevention Point Philadelphia, which is a needle exchange program also doing HIV testing and a wide range of social services in the section of the city where people whose language is Spanish are more likely to live. This program, which is funded by a federal grant, is going to make it possible for the expertise of Philadelphia Fight, joined with the community base and expertise of Prevention Point, to provide first-class HIV treatment without regard for ability to pay to Spanish-speaking people in Kensington and other neighborhoods in that part of the city. And the way we're going to do this is we're going to actually have a clinic with infectious disease specialists from Philadelphia Fight as well as support staff in Prevention Point's offices. Many people will be able to be seen right there and will probably not need to leave the neighborhood with which they're familiar to get excellent care delivered by HIV specialists. For people who may need more, we will provide door-to-door transportation accompanied by people from Prevention Point, by a care navigator or case manager, to our offices in Center City, Philadelphia, where there will be someone there who will be able to provide them with maybe more complicated treatment or maybe more complicated social services needs. The clinic at Prevention Point will be conducted entirely in Spanish so that people who are more comfortable in Spanish will be able to come and will be able to get their care in the language that they prefer. This is a really hopeful time in the AIDS epidemic, a really hopeful time. We have about 32 drugs now that work, that if people take these medicines, they can live a normal life and they can live a normal lifespan. And we know that if people get these medicines early in their period of infection, they're going to be healthy for the rest of their lives. And even if they get the medicines later in infection, they will be able to recover their health. The barriers to care in our community are not, at this point, about science. They are about culture, about access, and about money. And by establishing this clinic in the neighborhood where there are many people who we know need care, but who because of these barriers have been out of care, we think we're going to take a major step in addressing these barriers and have people in that community have the same access to services that they would have if they were in Center City, Philadelphia, where we have all these hospitals. So we are really, really excited about this partnership. And I think next I will call on Jose Benitez, who is the director of Prevention Point Philadelphia.
Can you just say your name one more time? The title?
Jane Shull.
Spell last name for us?
S-H-U-L-L.
Thank you.
Thank you, Jane. Jose Benitez from Prevention Point Philadelphia. We're the city's needle exchange program, and we are really, really excited about this announcement. The clinic will be held 3 days a week. At one point, as we we do our startup, our start date is December 11th. We are going to be in the zip code of 19133, which is where our offices are located now, which is one of the most affected zip codes with HIV and hepatitis C. And so in particular, as Jane said, it becomes an access issue at this particular point for the folks that are not in care, and we intend to sort of fix that problem. That's the goal of this, to provide access to people who are Spanish-speaking, although no one will be discriminated against in the clinic. It'll just be whoever needs care. But at the same time, we're targeting our Latino folks that may need some additional care without regard to how they can pay for it. We're really excited about this project. We have a 5-year commitment from the federal government to do this project, and we also want to thank and recognize North Square Civic Association, who will be conducting some of the HIV education and outreach in the Latino community as well, to sort of inform our folks about HIV and the services that are available. So I wanted to thank Philadelphia Fight, and we look forward to working with you guys. Councilwoman.
I want to acknowledge our council colleague, Councilman O. Thank you for joining us this morning at this wonderful announcement. As Councilwoman Tasco spoke to, when I worked for her when we were in council, and Councilwoman is the chair of Health and Human Services, some of the work that's being done was pioneering. Philadelphia has been a pioneer in really addressing what has been a delicate situation. The siting and the work that Prevention Point does in the community sometimes is controversial, very needed, very proactive. And so I'm very happy with the collaboration between Philadelphia Fight and Prevention Point and the work they're trying to do in the community as we educate folks. As Jane says, there is the ability for people to live a fulfilling life, but people have to come forward. They have to be tested. And the type of work that we're doing here, particularly in an area that is vitally needed and critical given what the situation of 133 is very important. So I want to congratulate them, because this is about the public-private partnership. Their leadership in soliciting this national grant, the ability for us to be competitive at a national level to get this type of grant, this 5-year commitment could be a game changer to the type of services that we deliver there. So thank you, Jane. Thank you, Jose. Thank you, Councilwoman Tasco, for your strong leadership in this for many, many, many years. And we look forward to working in the partnerships with North Square Civic and all the other partners and getting the information out so that people can come forward and, as Jane said, get very good care, and we can provide a respectful, culturally sensitive environment by which we can service them. So thank you very much. Any questions for Jane? Any questions? Gracias.
So you know it all, right?
Thank you.
Thank you.